Hi, I'm Dr. Lewis Johnson, CEO of Alelo. I'd like to introduce to you Alelo's rapid training solution for community health workers and the Enskill training and data collection platform that it runs on. Our solution strengthens health emergency response with trained public health workers at the point of need. It uses a combination of AI-driven capabilities, including avatar-based simulations, automated assessment, immediate feedback, personalized learning, and learning analytics. Enskill is as much a data collection platform as a learning platform. It supports rapid retraining and adaptation of training content in response to evolving health emergency conditions. Training is built around example cases, which trainees can view, discuss, and most importantly, practice. We start with cases that illustrate contact tracing. Contact tracing is a good place to start because it is an important part of public health response and because it involves key competencies that community health workers continuously make use of in their work. The examples you see here use simple stylized avatars suitable for low bandwidth environments. We also use interactive 3D avatars in other courses. First, I'm going to watch how a contact tracing interview is done. Then I'll get a chance to practice it myself.
Hello?
Good afternoon. My name is Sarah Hernandez, and I'm calling from the Department of Public Health. Is this Ms. Rodriguez? Initially, address the patient by their title and last name. If you're unsure, it's a good idea to ask how the patient wants to be addressed.
I'm Miss Rodriguez. Why are you calling me?
I need to speak with you about COVID-19 and your health. Is now a good time to talk privately?
Then we walk through the case and explain what you need to do and why.
The beginning of a contact tracing conversation is simply about making sure the contact knows who you are and that you have reached the correct person. You will also need to address confidentiality. If possible, take the time to start building trust with the contact. Let's go through these one by one. It is important that the people you make contact with understand who you are and why you are contacting them.
Then the trainees have an opportunity to start practicing these skills. Hello, this is Lewis from the Department of Public Health. Am I speaking with Ms. Rosalie Rodriguez? Call Rosalie Rodriguez.
Hello?
Hi, this is Lewis from the Department of Public Health. Am I speaking with Ms. Rosalie Rodriguez?
This is Miss Rodriguez.
Great. I'm glad we had a chance to talk. I'd like to talk with you about some health concerns related to COVID-19.
Oh, goodness. What is it?
I'm afraid you've been in contact with someone who's tested positive for COVID-19.
Oh, my. Is it Luis? I told him he shouldn't be going to those parties.
I'm afraid I can't discuss that with you. We keep everybody's health information private.
Okay, I understand.
And everything we talk about today will be kept private as well.
Okay, this sounds serious.
How have you been feeling the last few days?
I'm feeling fine. I haven't been sick at all.
So now I get a review of how well I did. I got an overall mastery score of 65%, which suggests I've got some room to improve. So I was able to introduce myself, build rapport, explain the purpose of the call, etc. But I did not do enough to verify that I was talking with Rosalie Rodriguez. I did not check her birth date, for example. So that's something that I could then practice further in subsequent practice scenarios. And it also checks the amount of time it took me to go through the scenario. So I was able to go through it fairly rapidly. I did not have to stop and think about what to say. Probably practice and improve some more, but I'm making good progress here. So now I have an opportunity to replay the conversation and see if I can improve or else move on to the next exercise. Now this is just a simple case to help trainees get started. As they progress through the course, they encounter increasingly complex cases that help them develop their CHW competencies. By the end of the course, they will have had a lot of opportunity to practice and are ready to join a public health emergency response team. Trainees around the world are using Enskill, and Enskill analytics make it possible for trainers and program navigators to easily track trainee progress. Here, for example, is a course that is underway right now in Kazakhstan. We can track for each student how much time they spent practicing, and then we can drill in to get further detail of how they are spending their time and how they are progressing toward mastery. I'll now conclude with a promotional video that illustrates the potential of Alelo technology to rapidly reskill workers for new jobs in the post-pandemic economy, and not just in public health. This will give you a sense of the power and potential of our innovation.
The world is changing faster than ever, and if we're going to get people back to work and prepare them for the modern workforce, we need a better way to rapidly teach them new skills. That's where Alelo comes in. We believe Alelo's AI-driven experiential learning is the key to large-scale rapid reskilling. Learn more at alelo.com.